Here's just an overview. We're going to talk about why it's important, some of the laws about medical interpreting, the training that you need, the technology that's used, and then kind of the future of it. So first, why is medical interpreting important? In 2015, 9% of the U.S. population spoke English less than well, and people with limited English proficiency are less likely to receive the correct care, they're less likely to be satisfied with their care, and they're at an increased risk of medical errors. So we're just going to watch this little skit from medical students about some of the problems.
Okay, let's go.
Hi, how are you, Mrs. Smith? I'm Dr. Morrison. Nice to meet you. How are you doing?
Oh, she doesn't speak English. Do you mind my classmate?
Sure, are you related or?
I'm her brother.
Oh, okay. And have you translated like this before?
Oh, I've done this before. She's coming in.
We can get a translator, but
yes, I can do it. Don't worry.
oh, okay. All right. So, can you tell her, ask her why she came in?
Tem que saber o que você está aqui, olha.
Ai, como essa dor começou semana passada, né? Dor da minha barriga.
She's having some belly pain.
Okay. When did it start? Can you answer when it started?
2 weeks ago.
Oh, just 2 weeks ago? Okay.
Ah, é que tem que conversar com você primeiro, espera aí. Deixa ele falar e depois a gente vai ver que a gente cuida pra você.
Sorry. Oh no. Can you ask her if she has any like nausea, vomiting, hematemesis, hematochezia, fevers, or any other symptoms, or did she eat anything funny last night, or has she had this before?
Tem que saber se você tem uma outra doença.
Eu tô com dor de barriga, não consigo mais.
Sim, não.
Eu não sei mais o que tá acontecendo.
No.
No. Okay. Does she have any other medical problems that she's had before?
Você tem alguma outra doença, pressão alta, você tem alguma outra coisa?
Lembra aquela vez que eu fui no médico que a minha pressão tava alta?
Eu lembro disso, mas você acha que ele quer saber acerca disso?
Sim, me deu um remédio, mas eu parei de tomar, e depois mamãe disse que eu tinha asma quando eu era pequena.
Ah, mas isso foi por muito tempo atrás. Eu acho que você não é. Você acha que você tem?
Eu tenho, mas não sei se vai ter de novo. Mamãe disse que isso é de volta.
É que você tem uma ideia, com uma pressão alta.
Ah, ele tem um remédio, mas eu parei de tomar.
She doesn't have any other medical problems.
Oh, she said she didn't have any other medical problems. Okay.
Yeah, Dr. Morrison, I think I found some free air on the diaphragm of her x-ray.
Oh, on her x-ray?
Yeah.
Oh, okay, hold on.
Hey, wait, what's going on?
So that was just a skit. You're going to see them laughing. But, so that just shows some of the problems with this because of,
Okay, let's go.
like, if you just have a friend or a family member translating, like her brother, you can see there was a lot of things that they were saying that the doctor wasn't hearing. So a lot of the questions, he was just summarizing her answers, and there could have been something important in there that the doctor needed to know. For that one question about how long she had that pain, he just answered it without even asking the patient herself. The brother just answered it. So you can see there's a lot of things missing. And some of the big words that the doctor was saying, I'm sure that that guy probably didn't know the direct translation to that, so that lady probably didn't understand the full question. So that's one problem. And this link I'm actually going to do at the end if we have time. So some of the laws, Title VI of the 1964 Civil Rights Act says that you can't discriminate based on national origin. And the Supreme Court has actually treated discrimination based on language the same as national origin. And in 1980, the Department of Health and Human Services actually said that no person can be subjected to discrimination because they have a primary language other than English, specifically about healthcare. So some of the training, usually you need a bachelor's degree in Spanish, but you can also do certificate programs as well. And obviously the most important thing is having that specialization in medical terminology. So this is just a little video of if you're interested in medical interpreters, but it kind of highlights some of the things.
Hi there, my name is Rose Potter, and I'm an instructor with the CPE's Medical Interpreter Certification Program. Healthcare entities all across our nation, state, and city are looking for certified healthcare interpreters. And it may be that that's the perfect path for you. So do you have what it takes to be a certified medical interpreter? Well, let's look at 5 characteristics to become a certified Spanish medical interpreter. Skill number 1, having a strong command of medical vocabulary. Most bilingual people are not born that way, but our program will help you develop the core medical vocabulary that you need, as well as the cultural nuances that support that language. Skill number 2, have strong interpersonal skills. You are the bridge between the patient and the healthcare provider. You have to take into consideration the contents, the context, and the emotional state of the patient and the healthcare provider. Skill number 3, be respectful of a patient's privacy. You are legally required to protect not only a patient's privacy, but also their healthcare records. You will know this because in class we review the national standards and the code of ethics. Number 4, be an extremely good listener. Listening is more than just words. It is cultural assumptions, tone of voice, vocabulary. It includes body language, gestures, so many things. And we get the opportunity to practice them in our classes, in your field placement, and also on the online modules. Skill number 5, be culturally aware. All communication is culture bound. And the medical interpreter has to constantly be aware of the possibility of a miscommunication based on culture. If you fit those 5 characteristics or would like to develop them, we'd love to see you in class.
So this just highlights some of the reasons why you also need someone who's trained to do this, not just a friend or a family member or someone who's already working in healthcare and just knows a little bit of the language. They don't get that training about the cultural sensitivity, being able to be a good listener. That's something that is more specific, and it's also something that you need different from just being a general translator or interpreter. So technology is also used to help translate as well, so not just a professional doing it. There's also the machine translation, or EMT, which is really good for smaller healthcare providers who don't have the kind of salary that it takes to have an interpreter on staff all the time, especially since there's so many languages that they could need. So this is really useful because it's fast and inexpensive, but you don't have that human checking it and proofreading it and making sure that it's actually correct, so it won't see cultural nuances or phrases or anything like that. Editors, so for documents this is really helpful. So a hospital could send some documents to an editing service or a translating service, and they can make sure that that is correct. And then phone or video interpreters. This is really good because it's remote access, so you don't need to have someone on staff all the time, but you also have that access to a language whenever you need it, and you still have that personal touch of a person doing it, and it's not a machine, so that's less likely to make the errors. So the projected 10-year growth of interpreters and translation jobs is actually 18%, which compared to the 7% job outlook, which is the normal for all the jobs, that's a lot, which makes sense since immigration is projected to increase a lot too. And video remote interpreting is actually the one that is getting more and more popular, just because you don't need to have someone on staff all the time, but you still get the interpreting that you need.
Hi everybody, John Daly here for TransStream Global. Imagine a world with no language barriers. I want you to think about this. The following is an example of something that happens too often in the real world. A child was just brought into the emergency room by his mother, who speaks only Malayan. His vitals are failing rapidly. She's frantically trying to tell the doctor what happened. He has about 10 minutes to determine what the woman is saying, or the child will die. There are no Malayan translators on staff. The only option is to now call a translation service. The wait time locating a translator could be as long as 15 minutes. TransStream Global has developed an innovative solution to break through all language barriers. TransStream Global provides two-way video transmission of live translators to your smartphone or any device connected to the internet 24/7. Thanks for watching, and remember, when it comes to healthcare reform, TransStream Global will be there to make a difference.
So that's just one of the reasons why video remote interpreting is becoming so popular now. I'm actually going to go back to this link, which is just about deaf patients, so with ASL, because that's one of the biggest problems now, is having an ASL interpreter, because you can't use like the online interpreting, like you can't use Google Translate for ASL, and you can't call someone over the phone and use ASL. Like it has to be in person or over video, so that's one of the problems in hospitals is having ASL translators. So this is about a deaf patient who didn't have anyone at the hospital who understood what he was saying. And the problem with the technology, with the video chat, was it took too long, and in emergencies that's not good. Obviously it only takes a few minutes, but sometimes a few minutes can be can make a big difference when we're talking about medical emergencies. So eventually they just had to have him write down what he was trying to say. But a stat review of hospital inspection reports found that dozens of instances around the country where deaf patients said they were not provided adequate interpreter services. So this is a problem with because it is a civil right that people have an interpreter available. So this is something that hospitals need to work on in the future. So I guess it's a problem to be dealt with in the future. But yeah. Are there any questions? And these are my sources, obviously. But